Okay, now we go to the chemistry test for the evaluation of your pleural fluids. So we have here the glucose value. So again, when you are taking the level of the glucose here should also be in relation to the blood glucose level. So decreased blood glucose here or decreased pleural fluid glucose will be related to your tuberculosis. And just like our blood here, so less than 60 mg per dl, we consider already that one as a decrease. And again, that might be related to your tuberculosis. Increased lactate level will be related to bacterial infection. For the pH, so we have here pH of less than 7 signifies the patient to be given a chest tube drainage or should be given antibiotic here in the case of the pneumonia. For the pH here, less than 6 or very acidic pH, it might be related to your esophageal rupture because of accidental puncture of that and might be because of becoming more acidic because of the increase in your gastric acid. Your pH will become more significant here if you try to compare that one with your blood pH. If the value of your pleural fluid is less than 0.3 degrees compared to the blood pH, then that's very significant. Okay, then we have here your adenosine deaminase. Okay, so more than 40 unit per liter signifies tuberculosis. And increased amylase would always related to your pancreatitis. Okay, now we have here the microbiologic test. So we have here the causes of your bacterial infection related to your lungs. So it might be because of your staph, but also your Enterobacteriaceae or even your Mycobacterium tuberculosis. So therefore, a gram stain, culture sensitivity, and acifastin are required for that in order for you to diagnose. Serological testing, so in the presence of your autoimmune disorders like your SLE and the RA, so you need to perform the anti-nuclear antibody testing or could also have the rheumatoid factor in the case of your rheumatoid arthritis. They could also have here the tumor marker in the case of your malignancy, so like your carcinoembryonic antigen for ovarian cancer. We have also here the CA125 for your uterine cancer. And we have CA15-3, 549 for your breast cancer, and we have your CY FRA21-1 related to your lung cancer. Okay, now we go to your pericardial fluid. So pericardial fluid here is a body fluid. It's a serous fluid that try to be found within your heart cavities. Okay, so normally your heart fluid here, pericardial fluid would have here 10 to 50 ml volume only. So just in case we have here increased volume, more than 50 or more than that, may be related to your effusion. Transudative type of your pericardial effusion is related to the following. So we have your metabolic disorders, including your hypothyroidism, your uremia, or even your autoimmune disorders like your SLE and then your RA. Exudative type of your pericardial effusion related to your increased capillary permeability related to your infections. We're talking about your endo. Endo is your heart, carditis is the inflammation infection related to that. Okay, so effusion here in the heart could be identified by during the examination with a physician because of the cardiac compression. Okay, for the appearance, normal pericardial fluid is clear yellow. You could also receive spasm and is highly turbid related to high level of your WBC related to your microbial infection. Could also have the blood streak related to your malignancy. Grossly bloody specimen may be related to your accidental cardiac heart puncture, sakit. Or you could also have here your anticoagulant misuse. They could have your milky specimen, again still related to your chylus and the soluchylus. Laboratory test to be performed in your pericardial fluid first. Of course, you need to take the ratio of your fluid serum ratio related to your protein, lactate dehydrogenase to just base your normal values with a table kanina if to classify the fluid here as transudate or exudate. Then we have also here WBC count less than 1,000. More than 1,000, which are high in the neutrophil, would always signify bacterial endocarditis. Okay, then we have also here the cytologic examination for the carcinoma related to your heart. So you could have here your metastatic carcinoma of your breast. Could also have here your lungs. Okay, and you could also have here your giant mesothelioma related to your asbestos contact. For the microbiome, so it might be related here to bacterial endocarditis infection related to that. It might be caused here by the following bacteria. You have your staph, your strep, your Haemophilus, or even the viruses like your adenovirus, and we have also Coxsackie virus. Sometimes, if it's related to your tuberculosis, maybe because of those patients having AIDS infection. Okay, the last one, we have here your peritoneal fluid. So, peritoneal fluid, another name for that is your ascitic fluid. So, this is the serous fluid here that try to flow within our gastrointestinal tract. Okay, so increased level of your peritoneal fluid may be related to your transudative type. That's your liver cirrhosis. Exudative type of your peritoneal fluid diffusion is related to your appendicitis or intestinal perforation. Then we're doing here peritoneal lavage, basically to identify the presence of your blunt trauma affecting here your gastrointestinal tract. When you're doing that one, so you are introducing saline, NSS, in order for that to be cleaned up, in order for you to identify the presence of your traumatic injury or the blunt trauma. So it could be identified here by having RBC count more than 100,000, and it's also be identified also with the help of your X-ray. Okay, then we have here the differentiation between your transudate and exudate with your peritoneal fluid. The best way to differentiate is by taking the difference of your albumin level between your blood versus here the peritoneal fluid. If the difference of your serum albumin is less than or more than 1.1 compared to the peritoneal fluid, then that's your transudate. Again, transudate for this one is related to your liver cirrhosis. And if, however, here the difference of your albumin with your blood and your peritoneal fluid is less than 1.1, then you consider here your exudative type of effusion. Your exudative type of effusion related to your peritoneal fluid includes your appendicitis and your intestinal perforations. Okay, then we have also here your appearance. So normal peritoneal fluid is clear yellow. Again, turbid na specimen would signify high WBC count that might be related to your tubercular infection or bacterial, or even your tubercular or fungal infection. Then we have also here your greenish or dark brown related to the presence of the bile. And you need to confirm this one with your test for your bilirubin. And we have the blood streak here related to tuberculosis or even some malignant disorders. And a milky specimen, then you need to classify if this one is due to your chylus or pseudochylus mechanism. Okay, then we have here the cellular examination. So for your WBC count, the normal values for that is less than 350 cells per microliter. However, increased level of the WBC count may be related to your peritonitis. We're talking about your appendicitis, or it could also be related to your cirrhosis. To differentiate the two, then you need to perform your absolute neutrophil count. When you're doing your absolute neutrophil count, if the result here is more than 250 cells per microliter, then that signifies your peritonitis. Example for that, your appendicitis, not your liver cirrhosis. Then we have here the cellular examination. So microbiologic here, the causes of your peritonitis or bacterial infection related to your gastrointestinal tract may be related to your bacteria or even your yeast or even your Toxoplasma gondii. Okay, then we have also here some malignancy may be related to your gastrointestinal tract, prostate, or even your ovary. Could be identified through your peritoneal fluid. Okay, then we have here malignancy coming from your ovaries, prostate, or your colon, characterized here by malignant cells which has having a large mucin-filled granules. Sometimes you could identify the presence of your samoma bodies. It's the large cells with concentric striations made up of your collagen-like materials, and that samoma body will be related to your cancer of the ovary or thyroid. On the other hand, you could also have your tumor markers. You're positive for the CA125, but then you are negative for the carcinoembryonic antigen. It might be related to cancer originating from your ovary, fallopian tube, or your endometrium. And lastly, for the chemistry test, so glucose value here, the glucose value related to your tuberculosis. Amylase, increased value related to your pancreatitis or even your gastrointestinal tract perforation. Then we have also here your alkaline phosphatase also with your obstruction, gastrointestinal tract perforation. Then your BUN, creatinine, which are your kidney function tests. Increased value of that one would signifies your accidental bladder puncture. It might puncture during your parasynthesis when you're collecting your peritoneal fluid. And therefore expect to have increased value of your BUN and creatinine. Okay, so that's end for this topic. Okay, thank you for this.